The first wave of infection since China relaxed its COVID policy subsides. A new concern. The Omicron variant XBB.1.5 has been reported in at least 38 countries and is sweeping across the U.S. Yanfang is an associate professor with West China School of Public Health and an expert with the advisory group of the State Council's Joint Prevention and Control Mechanism.
XBB is a subvariant of Omicron. The X means it's a recombinant variant. We use the letter X to indicate that. The BB means it's a hybrid of two Omicron BA.2 lineages, hence XBB.
The cause of concern is the most transmissible variant detected yet, adept at dodging antibodies generated from vaccination, boosters, and previous infections.
There
are studies both home and abroad which indicate that the antibodies from the previous Omicron vaccination infections offer different levels of protection from the XBB in different people. Some studies suggest only 40% protection, others 50% or even 60%.
Especially since China eased its COVID-19 restrictions and reopened its borders, how likely will the XBB variant stir a second wave of infections with an influx of inbound travelers from abroad?
Based on many studies from both home and abroad, I think people shouldn't be over-anxious. XBB is still part of the Omicron family. We still have a significant number of antibodies generated from the epidemic, which can, to some point, neutralize the XBB. On top of that, we also have the T cells in our bodies, which give us some levels of immunity. Combining the two elements, I predict that there will be no second spike in infections in the short term.
Last year, from August to December, China reported 16 local cases of the XBB infection. Authorities said most of the cases were found in October, with only one case discovered in December. But China also ended its mass testing in December. I wondered how reliable is the data?
We dare not say the data is that accurate, but the Joint Prevention and Control Mechanism recently released operational guidelines for COVID prevention and control, which called for strengthened mutation monitoring of the virus. We have selected sentinel hospitals, which we will monitor the outpatient, ER, ICU, and death cases. We will also monitor our ports of entry, like airports and border crossings, and conduct whole genome sequencing on any positive case detected. One purpose of this is to monitor imported cases of XBB, but we can't be sure the virus isn't mutating still. So, we are also trying to detect any possible new COVID variants.
The WHO has released a risk assessment report stating that the XBB Omicron subvariant has a growth advantage and will likely to cause global COVID cases to increase. But the body also said that they can't be certain at this point because all the data it relied on came from one country, and that's the United States. It adds that the XBB has no mutations that are known to make people sicker. Taoyuan CGTN, Chengdu.